I want to hear just about your story, how you got into dentistry, and then how you founded teledentistry.com.
Oh, wow. Okay. That's a big one at this point
No
because
pressure.
yeah, no
Yeah.
pressure at all, right? Yeah. I got into dentistry after, I took an exam and got in. Not too sexy a story there. Unfortunately, no repeat failures and all that stuff. I don't have that to my name. But that being said, I definitely just love the profession, and once I got into private practice after graduating from school, and you and I went to school pretty much together at Boston University. That's how we got to know each other, obviously. And so after that, after getting to private practice, it became apparent to me that there are so many different facets to what we do. It's not just clinical dentistry. There's the business aspect. There's also the insurance aspect, and what happens outside of that insurance aspect. And so I started looking deeper and deeper into those kinds of things, and I founded a dental insurance brokerage firm because I really wanted to get into the insurance industry to kind of understand how it all worked. It was extremely intriguing to me. We grew that company from scratch to a multi-million dollar, dental insurance brokerage firm. We had about 3,000 dentists on the network, and supported by about 7,000 sales agents, from California all the way to Florida. And we did great. It was an amazing experience, and I learned a lot about how dental insurance works. What's the nuances of it, and why dentists hate it so much, as well as why patients hate it so much. And if it's hated so much, then why is it still there? It's an intriguing question. Everybody seems to hate insurance, but a dental insurance specifically. But when you go and buy it, and you go into the market and you say, hey, what insurance would you like to buy? From a sales perspective, everybody says they want dental. It's a weird sort of a thing that we experience. And so for me, I looked at that and I said, there's got to be some way to kind of optimize that experience, and to make it so that we add features to the insurance that enable a patient to utilize the policy whenever they want. You see, a lot of times we would find that a patient would have a dental emergency, and then they couldn't find their dentist, or they couldn't get access to a dentist, whatnot. And so I came up with the concept of teledentistry.com, and essentially telemedicine for dentistry. And this was way before the pandemic, and 2017, in fact. And we pitched it to Medicaid in Nevada, and that was our first client. And we went right away from 0 patients to 300,000 patients. It was a bit insane. And our goal was very simple: helping people avoid the emergency room, when they have a dental emergency. So you see how it kind of morphed along the way. And that's typical of, any entrepreneurial sort of a journey, so to speak. You come up with an idea, you start digging at one end, and then you kind of don't know really where you end up at the other, but you do end up solving problems along the way. And soon enough, we had about 5 million patients on our platform, all from different states, all on Medicaid. And that was our job, was to basically help patients when they're having a dental emergency avoid the emergency room. And we would do a virtual triage, video conference, do evaluate the patient, and then prescribe antibiotics and pain medication as appropriate. No opioids, of course, and that would be sent electronically to their pharmacy. And then that's that. Now, the key thing is here is this: that same set of treatment that I just described would be done in the emergency room and would cost the state thousands of dollars, whereas we're just charging, dental rates, if that makes sense, for the same service. So the cost savings were just astronomical for the state. And that's kind of how we kind of got our start. Needless to say, COVID hit in March of 2020, and we now have about 50 clients, all different insurance carriers, and about 100 million lives on our platform that have access to our service. And so that's kind of where we are on that side of the business. And soon we'll discuss our AI platform, I'm sure. So